and is further continuous with the cavernous sinus. And I know I showed you guys the cavernous sinus, right, when we talked about sinuses. So I want you to get that sense of this continuation of venous blood from the exterior to the cavernous sinus. So why is that important? Clinically, it's as you can imagine, if you happen to transect this vein, you're going to lose a lot of blood. Okay, so you want to avoid this vein. And you can see how superficial it is. So let me move over here. Okay, so the most important thing that I want you guys to visualize on this dissection is to get a sense of the three-dimensionality of this region relative to the periorbita. So on your dogs, the temporalis muscle has been removed. So here it's still intact. We still have the ramus of the mandible. The masseter has been removed. And then also the zygomatic arch has been cut through on your dogs. Okay, so when you get back to the dissection, this has been taken off, this has been removed. One structure that you should be able to see, since this has all been removed, is this structure. Do you guys remember, or do you guys know what it is? It's a gland. It's a gland thingy. Okay, good.
Maxillary.
The zygomatic gland. Okay, so it doesn't actually contribute to the function of the eye, but you can see that there's a fair amount of soft tissue that's just ventral to the periorbita. Okay, so let's go over here. Okay, so in this specimen, the temporalis muscle has been completely removed, and then the zygomatic arch has been removed, and then a portion of the ramus of the mandible. The mandible, the rest of the mandible is intact, but the ramus has been removed. So you can really appreciate the three-dimensionality again of the periorbita relative to these other structures. So one structure that is visible here that you guys have heard about but are until now have not seen is this structure here. It's actually a muscle, and you can see the fascia of the muscle, or the tendon of the muscle. What part? Pardon me?
Is it digastric?
No, that's down here.
Is it the retractor?
Any ideas?
Retractor.
So remember that space, that annoying space that's within this region that you guys had to learn, but you didn't actually see. So, not a sinus. So, remember the pterygopalatine fascia, okay? Or the fossa, excuse me. This is the lateral pterygoid, okay? Oh, yeah, and you'll see this more in the GI block. So that's just, again, you can see this relationship. It's just ventral to the periorbita of the eye.
It's on top.
Okay? So now, let's look at some of the blood vessels here. Just as a review, quick review, common carotid, the lingual, okay, external, internal, deep to this, facial. Now remember, cauda-auricular, superficial temporal. So you guys, when you identify the maxillary artery, you just saw a small branch diving behind, or just medial to the ramus of the mandible. So now you're actually seeing all of it as it's going through, as it's entering the caudal alar foramen and exiting through the alar canal and exiting through the rostral alar foramen. So the continuation of this, which you guys identified out here, is the infraorbital artery. Okay, so one key structure here that you guys are going to see also is this nerve.
Infraorbital nerve.
So yes, it's not quite infraorbital at this point. So this is still the maxillary nerve. Okay?
But the artery is infraorbital at that point?
No, this is
maxillary still.
It's still maxillary.
Okay.
So it doesn't actually become infraorbital until it enters the infraorbital canal.
Okay.
Okay.
But they're both maxillary and they're both infraorbital.
Right.
Okay.
Okay. So the reason I'm pointing out the vessels, just as a review, but also I want you guys to see the arterial supply to the orbit. So the first small branch coming off of the maxillary artery as it exits the rostral alar foramen, and you can kind of see a little stub It's not easy to see because it's coming off just as the maxillary artery exits the rostroalloforamen and it's entering into the periorbital. That is the external ophthalmic artery. Okay, you might be able to see it a little better over here. So there are two major ways to get arterial blood into the periorbita to vascularize the structures, internals of the periorbita. So external ophthalmic coming from maxillary. Also, there is an internal ophthalmic, and that is coming from the rostrocerebral artery. Does that sound familiar? Yeah. So you guys saw this a couple of weeks ago from the Circle of Willis. Okay, so external and internal. All right. So moving over here. All right. So again, we have the lateral pterygoid right here. So what I'm going to do is try to point out some of the more visible muscles of the eye. And actually, one thing I forgot to show the other groups is the lacrimal gland. You can actually see it right here. Okay. So muscles. This is the dorsal rectus. Now, sitting on top of the dorsal rectus is this small, skinny muscle that appears to be inserting into the eyelid. This is the levator palpebrae superioris. Okay. Lateral is the lateral rectus. It's pretty easy to find. This small muscle here is actually a tendon, a pulley, if you will, of the dorsal oblique. So you can't see the dorsal oblique as it's inserting into the globe, but this is the tendon of the pulley.
What about the trachea?
That's been cut off. Okay, and then ventral, we have the ventral oblique, and then if I split these, or if I try to separate out the musculature, you'll see tiny fascicles, skinny fascicles of muscle